Hello, welcome to Chapter 1 of Medical Language. This chapter introduces you to the basic principles of medical language, the framework of which the practice of medicine is built. It also provides an overview of common terms used to describe the body in health and disease, as well as a brief look at various settings and techniques associated with modern healthcare. Let's go ahead and immerse ourselves in the language of medicine. Before we begin, let's quickly review the learning outcomes for this chapter. Learning outcomes are your overall guide to what you need to learn. They also serve as tools to help you measure your progress as you go through the chapter. By comparing your progress against the learning outcomes, you won't have to guess whether you're on the right track as you study. You'll know for sure. So our learning objectives for Chapter 1 are as follows. Upon completing this chapter, you should be able to identify the 5 skills of medical language communication, describe the origins of medical language, form the plural of common medical singular nouns, identify the characteristics of word parts such as combining forms, suffixes, and prefixes. You'll also give the meaning of common medical word parts, divide the medical words into word parts, build medical words from word parts, spell and pronounce common medical words, and define health and disease. You'll identify body planes, directions and positions, body cavities and body quadrants and regions, describe anatomy and physiology, body systems and medical specialties, describe categories of diseases, describe categories of healthcare professionals. Welcome to medical language. Medical language is the language of the healthcare profession, and medical words are the tools of the trade. So learning medical language is your key to a successful career in the healthcare field. Right now, medical words may seem complex, but as you study, you will learn their meanings. You'll also see that medical words are like puzzles, and their word parts are like puzzle pieces. If you put the word parts and their meanings together correctly, you will get the whole picture and understand the definitions of most medical words. This concept is something you will see over and over again as you move from chapter to chapter. Still, studying medical language involves time and effort. Learning it is a bit like learning a foreign language. It will take time, practice, and patience, but healthcare professionals who are on the job every day know that there is no substitute for thorough working knowledge of medical language. Our assignments are limited. I will grade you on the pieces that are in the syllabus. However, it's up to you if you want to put in the extra work to really understand all of the medical language components that are in your chapters. I encourage you to use all the exercises and practice each of the sections at the end of your chapter. Now let's start our study of medical language by talking about communication in general. Communication in any language, including the language of medicine, consists of 5 skills. You must master all 5 skills to communicate effectively in a particular language. The 5 communication skills as they relate to medical language are as follows. Reading medical words, hearing others speak medical words, thinking, analyzing, and understanding medical words, writing or typing and spelling medical words, speaking and pronouncing medical words. The first 2 skills, reading and hearing medical words, involve receiving medical language. This is similar to the input coming into a computer. This third skill, thinking, analyzing, and understanding medical words, is similar to the processing function of a computer. The last 2 skills, writing and speaking medical words, involve relaying the language, the medical language. This is similar to the output generated by a computer. All of these skills are critical to the communication of medical language. This text will help you develop all these skills by giving you many opportunities to practice until you've mastered them. While, again, this is not necessarily a graded assignment, if you use all the practice opportunities, this will help you master medical language. So where did it all begin, medical language, that is? It is the etymology. Etymology is the study of word origins. Many medical words have their origin in languages other than English, particularly Greek and Latin. This is the case because both the ancient Greeks and the Romans advanced the study and practice of medicine. Centuries ago, they named anatomical structures, diseases, and treatments in their own languages, and many of these Latin and Greek words remain a part of medical language today. You may be surprised to find out how many of these Latin and Greek words you already know. Some medical words are identical to the original Latin or Greek words. For instance, all of the words shown on screen today come directly from their language of origin. Nucleus, pelvis, and sinus is from Latin, and paranoia and thorax is from Greek. That's directly from their language of origin. Many other medical words are similar but not identical to Latin or Greek words. Take a look at the examples on the screen. Notice that these medical words contain most but not all of their Greek or Latin source word. Often only the end part of the source word has been changed. Like artery, in Latin it's arteria. Urine, Latin is urina. Vein, Latin is vena. A smaller number of medical words come from languages other than Latin or Greek, such as Old English, French, or Dutch. Again, several examples provided on screen. Bladder, drug, the Old Dutch word was droog. Now that we've seen where medical words come from, let's consider the singular and plural forms of these words. Here, knowing a medical word's language of origin is especially useful because different source languages have different rules for forming plurals. For example, in English, most singular nouns form the plural by adding an S. So gland becomes glands, hormone becomes hormones, and so on. This isn't always the case. However, many English singular nouns that end in Y form the plural by changing the Y to IES. Thus, artery becomes arteries, and ovary becomes ovaries. Still, other English singular nouns are irregular in that they follow some other pattern or no pattern at all to form the plural. But what about medical nouns that are Latin or Greek? Each of these languages had specific rules for how to form plurals, and those rules still apply today. Let's start with Greek, which has 4 rules for forming plural nouns. The ending letters of a Greek singular noun determine which rules applies. So, when a Greek singular noun ends in IS, form the plural by changing the IS to IDES. Consider the word iris, whose plural is irides. When a Greek singular noun ends in NX, form the plural by changing the NX to NGS. So the plural of the word phalanx would be phalanges. When a Greek singular noun ends in oma, form the plural by changing the oma to omata. An example is the word carcinoma, whose plural is carcinomata. Finally, when a Greek singular noun ends in on, form the plural by changing the on to an a. The plural of ganglion would be ganglia. Latin is slightly more complicated than Greek because it has 5 rules for forming plurals. Once again, the ending letters of the singular noun determine which rules apply. When a Latin singular noun ends in a, form the plural by changing the a to ae. So the singular noun vertebra becomes vertebrae, while the singular noun sclera becomes sclerae. When a Latin singular noun ends in us, form the plural by changing the us to I. Thus the bronchus become bronchi, and thrombus becomes thrombi. When a Latin singular noun ends in form the plural by changing the to a. So atrium becomes atria, and bacterium becomes bacteria. When a Latin singular noun ends in is, form the plural by changing the is to es. So diagnosis becomes diagnoses, and testes becomes testes. Finally, when a Latin singular noun ends in ex, form the plural by changing the ex to ices. So apex becomes apices and cortex becomes cortices. We're now ready to discuss perhaps the most important aspect of medical language, the word parts. Recall from earlier in the lesson that medical language contains medical words, and most medical words contain word parts. Word parts are puzzle pieces when fit together build a medical word. If you put the pieces together correctly and know what they each mean, you can understand the definitions of many medical words, even ones you've not encountered before. There are just 3 types of word parts: prefixes, combining forms, and suffixes. A prefix is an optional word beginning. A combining form is the foundation of a medical word. A suffix is the ending of a medical word. So you have the beginning, the middle, and the end. Most medical words have 2 word parts, but even the longest medical word has only these 3 parts of word parts. Because combining forms are at the heart of medical language, let's begin our study of word parts here. As previously mentioned, a combining form is the foundation of a medical word. It is the part that gives a medical word its main medical meaning. When written separately, a combining form has a root, a forward slash, a combining vowel, and a hyphen. Usually the combining vowel is an O, but it occasionally can be an A, E, I, or Y. The hyphen shows that the combining form is a word part, not a complete word. The majority of medical words contain a combining form. Some contain 2 combining forms, right after the other. For example, the word gastrointestinal contains the combining form gastro/o and the combining form intestine/o. Still, other medical words like blood, health, or heart do not contain a combining form or any word parts at all. Let's look more closely at an example combining form. In this case, the combining form cardio/o, cardi/o, which means heart. Notice that the first part of the combining form is the root, or the part that gives the combining form its medical meaning. A forward slash separates the root from the combining vowel. The combining vowel is followed by an ending hyphen, which shows that the combining form is a word part, not a complete word. Learning medical language requires some memorization of combining forms and their meanings. Why? Because knowing the meaning of a combining form allows you to look at a medical word and already know its definition based on the memorized meaning of its word parts. The alternative is having to look up every new medical word in a dictionary, and that's not practical. To make it easier to learn combining forms, it helps split them into 3 categories. Combining forms that are nearly identical to their medical meanings, combining forms that are similar to common medical words, combining forms that are not similar to their medical meanings. We'll explore each category in greater depth on the following screens. The first category of combining forms is those that are nearly identical to their medical meanings. These are the easiest combining forms to remember because when you see one of them, you already know its medical meaning. Common combining forms in this category include abdomen, which means abdomen, arterio, which means artery, intestine-o, which means intestine, musculo, which means muscle, thyroid-o, thyroid gland, veno, which means vein. The second category of combining forms consists of those that are similar to common medical words. When you see one of these combining forms, it likely brings to mind a medical word you already know, and familiarity with the medical word can help you more easily remember the meaning of the combining form. Let's consider some examples. The combining form arthro means joint. When you first saw this combining form, you may have thought of the word arthritis, which means inflammation of the joints. The combining form cardio means heart. This makes sense when you realize that cardio is similar to the word cardiac. The combining form dermo, means skin. You can remember this by thinking of the word dermatology. The combining form gastro means stomach. Thinking of the word gastric can help you remember this meaning. The combining form mammo means breast. Notice that this combining form is similar to the word mammogram. Finally, the combining form naso means nose. You can remember this by thinking of the word nasal. The third category of combining forms consists of those that are very different from their medical meanings. These are the most difficult combining forms to learn because they must simply be memorized. Common combining forms in this category include costo, which means rib, cyano, which means blue, intero, which means intestine, hepato, which means liver, laparo, which means abdomen, and lugo, which means white. As you study word parts, you will soon realize that two different combining forms can have the same meaning. For example, both the combining form abdomino and the combining form laparo mean abdomen. Similarly, the combining forms intestino and intero both mean intestine. Why is this the case? The answer lies in source languages, specifically Latin and Greek. These languages have different names for the same body structures, and in some cases, both names for a single body part have developed into combining forms. Let's now turn our attention to a second type of word part, suffixes. A suffix is a word part at the end of most medical words. It modifies or clarifies the medical meaning of the combining form. Remember, a suffix is never the foundation of a medical word. A suffix can be a single letter or it can be a group of letters. It always begins with a hyphen to show that it is word part, not a complete word. Most medical words contain a single suffix. Occasionally, a medical word has two suffixes. For example, the word nutritional contains the suffix ion, I-O-N, as well as the suffix al. Let's look more closely at an example suffix. In this case, the suffix ac, which means pertaining to, notice that the suffix begins with a hyphen to show that it is a word part, not a complete word. As with combining forms, medical suffixes can be broken into several categories. Here, however, the categories are based on what the suffix tells us about a combining form. This system gives us 5 types of suffixes. Suffixes for an adjective, for a process, for a disease, for a procedure, and for a medical specialty or specialist. Let's consider each category of suffix more closely on the following screens. The first category of suffixes consists of those that make a medical word into an adjective. Note that for each and every one of these suffixes, the definition is the same. They are all mean pertaining to. The reason we have multiple suffixes with the same meaning is that no single suffix can fit with every combining form. Common suffixes in this category include AC, as used in the word cardiac, which means pertaining to the heart. AL is used in the word intestinal, which means pertaining to the intestine. AR is in the word muscular, which means pertaining to a muscle. ARY is in the word urinary, which means pertaining to the urine. IC is in the word pelvic, which means pertaining to the pelvis. INE is in the word uterine, which means pertaining to the uterus. IVE is in the word digestive, which means pertaining to breaking down food. And finally, the suffix OUS is in the word venous, which means pertaining to a vein. The second category of suffixes consists of suffixes for a process. All of these suffixes indicate a process or action of some type. For example, the suffix ATION means being, having, or process. It fits with many combining forms, including the combining form urine-o to make the word urination, which means process of making urine. Other medical words that use this same suffix include respiration, inhalation, infiltration, and so on. The suffix ION means action or condition. It too fits with many combining forms, including digesto to make the word digestion, which means action of breaking down food. The next category consists of suffixes that make the medical word for a disease. These suffixes have a variety of meaning. For instance, the suffix IA means condition, state, or thing. One example of a medical word that uses this suffix is pneumonia, because the combining form pneumo means lung. Pneumonia literally means condition of the lung. The suffix ISM means disease from a specific cause. Many medical words end in ISM, such as hypothyroidism, which means disease from a specific cause of a deficient thyroid gland. The next suffix, ITIS, is probably the most common disease suffix. It means infection of or inflammation of. It can be used to indicate infection or inflammation of a specific structure anywhere in the body. For example, tonsillitis means infection of the tonsil. The suffix megaly means enlargement. An example using this suffix is cardiomegaly, which means enlargement of the heart. The suffix oma means mass or tumor. There are many kinds of benign and malignant or cancerous tumors, and their medical words often end with this suffix. A neuroma, for example, is a tumor on the nerve. The suffix OSIS means abnormal condition or process. An example word that contains this suffix is vaginosis, which means abnormal condition of the vagina. Last but not least, the suffix pathy means disease. When put together with a combining form arthro, it means the medical word of arthropathy, which means disease of a joint. Other examples that use the suffix pathy are neuropathy and retinopathy. Moving on, our next category consists of suffixes for diagnostic, medical, and surgical procedures. For example, the suffix ectomy is very common. It means surgical removal. Together with a combining form appendo, which we have talked about before, it forms the word appendectomy, which means surgical removal of the appendix. Other ectomy words you may recognize include tonsillectomy, hemorrhoidectomy, and mastectomy. The next two suffixes, gram and graphy, form a pair that go together. The suffix gram means picture or record, while the suffix graphy means process of recording. So, for example, a mammogram is a picture or record of the breast, and this image is obtained via mammography, which is the process of recording the breast. The suffix metry means process of measuring. An example medical word that uses this suffix is spirometry, which means process of measuring the breath. The next two suffixes, scope and scopy, all form a pair. The suffix scope means instrument used to examine, while the suffix scopy means process of using an instrument to examine. Thus, a colonoscope is an instrument that's used to examine the colon during a colonoscopy, which is a process that uses an instrument to examine the colon. Finally, the suffix tomi means process of cutting or process of making an incision. If you put the suffix tomi with the combining form laparo, which means abdomen, you get the medical word laparotomy, which means process of making an incision in the abdomen. Let's look more closely at example prefix. In this case, the prefix intra, which means within. Notice that the prefix ends with a hyphen to show that it is a word part, not a complete word. Like suffixes, prefixes can be split into several categories based on what they tell us about a combining form. This system gives us three types of prefixes. You have prefixes for location or direction, prefixes for amount, number, or speed, and prefixes for degree or quality. As previously mentioned, the second category of prefixes is related to amount, number, or speed. Let's consider some examples. The prefix bi means two, so the word bilateral means pertaining to two sides. The prefix brady means slow, thus the word bradycardia means condition of a slow heart. The prefix hemi, which means one half, an example of this using this prefix is hemiplegia, which means condition of one half of the body with paralysis, or half of the body is paralyzed. The prefix hyper means above or more than normal. Accordingly, the word hypertension means condition of more than normal blood pressure or high blood pressure. The prefix hypo is the opposite of hyper, which means below or deficient. So, for instance, the medical word hypothyroidism means disease from a specific cause of a deficient thyroid gland hormone. The prefix poly means many or much. So the word polyneuritis means inflammation of many nerves. Continuing our look at prefixes for amount, number, or speed, the prefix quadri means four, like quad. An example using this prefix is the word quadriplegia, which means condition of 4 limbs with paralysis. The next prefix is tachy, which means fast, so the meaning of tachycardia is condition of a fast heart. Finally, the prefix tri means 3, so the word trigeminal means pertaining to 3 nerve branches in a group. Now that you're familiar with prefixes, combining forms, and suffixes, it's time to take a closer look at how these elements fit together. Let's start by discussing how to analyze and define a medical word by breaking it into its word parts. So you read or heard or hear a medical word and want to know what it means. First, there are 4 steps. First, you divide the medical word into its combining form, suffix, and prefix, if there is a prefix. Second, determine the meaning of each word part. Third, put the word part meanings in order, beginning with the suffix, then the prefix, if there is one, and then the combining form. Finally, add small connecting words to make the definition. Let's work through these 4 steps with an example word in this case, cardiology. The first step in defining cardiology is to divide the word into its word parts. By now, you should be able to recognize that the parts in this word are the combining form cardio and the suffix logi. There is no prefix in cardiology. The second step is to give the meaning of each word. Here, cardio means heart, and logi means study of. Third, you need to put the word part meanings in order, starting with the suffix and then the combining form. This gives you the phrase, study of heart. Finally, you must add any small connecting words necessary to make a complete definition. Doing so gives us a study of the heart and related structures. There, you've just defined your first medical word. This process around and do the reverse of what we've just learned. Instead of defining medical words, let's learn how to build them. The steps in building a medical word vary somewhat depending on whether the word suffix begins with a consonant or vowel, as well as whether the word contains a prefix. Let's start with a word with no prefix and a suffix that begins with a consonant. Say we want to build a medical word that means study of the heart. The first step is to select the suffix, study up, and combining form whose meanings match this definition. This means we will select the suffix logi, which means, again, study up, and the combining form cardio, which means heart. Now that we've selected our word parts, step 2 of building our medical word is to put these parts in the right order. So we move the suffix after the combining form. It's now time to put the word's parts together because the suffix we've picked begins with a consonant. We keep the combining form's vowel, but delete the forward slash and hyphen. Then we delete the hyphen from the suffix and join the two word parts to create the word cardiology. Now let's look at building a medical word with a suffix that begins with a vowel. Say we want our medical word to mean pertaining to the heart. As before, the first step is to select the suffix and combining form whose meanings match this definition. This means we will select the suffix AC, which means pertaining to, and the combining form cardio, which means heart, as we know that. Our second step is to change the order of the word parts to put the suffix last. Now what do we have? It's now time to put the words together. Here our suffix starts with a vowel. So we delete the vowel at the end of the combining form along with the forward slash and hyphen. Finally, we delete the hyphen from the suffix and join the two word parts to create the word cardiac. The last situation we need to consider is how to build a medical word that pertains a prefix. This time, we want to build a medical word that means pertaining to within the heart. Once again, we choose the suffix AC, which means pertaining to, and the combining form cardio, which means heart, but we also select the prefix intra, which means within. Our next step is to change the order of the word part so that the prefix is first and the suffix is last. And now what we have? Now it's time to put the word parts together. So we delete the hyphen from the prefix, we delete the forward slash and hyphen from the combining form, along with the combining vowel because the suffix already begins with a vowel. Finally, we delete the hyphen from the suffix and join the three word parts, and you have the word intracardiac. You now know how to analyze and build medical words. Both of these are critically important skills for anyone who wants to work in healthcare, but they are not the only skills you need. You must also know how to spell medical words correctly. Remembering the spelling of combining forms and other word parts, as well as how to properly join these parts together, will help you develop these skills. It's also important that you know how to pronounce medical words correctly. Be sure to pay attention to the pronunciation guides found along the right edge of the pages in your textbook. Practice saying these words until you master the pronunciation. Finally, be aware that some words have more than one correct pronunciation. So far, we've spent most of Chapter 1 learning about word parts and how knowledge of these parts can help us build and analyze medical words. Now we're going to shift our focus to the body itself. We'll start by learning terms used to describe the body in health and disease. These terms are general rather than specific to certain body parts or body systems. After that, we'll discuss different medical specialties and categories of disease. Once again, we'll look at these topics from a broad perspective rather than focusing on any one body system. The best way to learn about the body in general is to start by considering it when it's in a state of health. The World Health Organization defines health as a state of complete physical, mental, and social well-being. This means that health is not just the absence of disease or infirmity. The healthy human body can be studied in several different ways. Each way approaches the body from a specific point of view and provides unique information by dividing or organizing the body in a logical manner. Let's begin by looking at the body in terms of planes, directions, and positions. When considering body planes, directions, and positions, we first need to establish a reference point. In other words, we need to know the standard position in which the body is studied. This position is commonly called the anatomical position. When the body is in the anatomical position, is standing erect with the head up and eyes looking forward. and legs are straight with the toes pointing forward. This image illustrates the anatomical position. Note the positioning of the head, arms, hands, legs, and feet. When we look at a body in anatomical position or any position, we use the terms left and right from the patient's perspective, not the practitioner's. So if we are looking at the front of a patient's body, the right side of the patient's body is to our left, and the left side of the patient's body is to our right. To reiterate, in healthcare, the terms left and right refer to the patient's left and right. Always, always remember this principle to prevent potential confusion. When the human body is in an anatomical position, it can be studied in terms of planes and directions. A plane is an imaginary flat surface, like a plate of glass, that divides the body into two parts. There are three body planes: coronal, sagittal, and transverse. Body directions represent movement toward or away from these planes. Let's take a closer look on the following. So the first plane we'll consider is the sagittal plane. This is a vertical plane that divides the body along the midline into right and left sides, as shown. The sagittal plane allows us to describe the body in terms of medial and lateral movement. Moving from either side of the body toward the midline is moving in a medial direction, or medially. Moving from the midline toward either side of the body is moving in a lateral direction, or laterally. Medial and lateral are opposite directions. Bilateral is a position that indicates both sides of the body. The second body plane is the coronal plane, also known as the frontal plane. This is a vertical plane that divides the body along the midline into front and back sections. The coronal plane allows us to describe the body in terms of front and back. The front of the body is the anterior or ventral section. So moving from the midline toward the front of the body is moving in an anterior direction or anteriorly. The back of the body is the posterior or dorsal section. Moving from the midline toward the back of the body is moving in a posterior direction or posteriorly. Lying face down is being in the prone position, while lying on the back is being in the dorsal or dorsal supine position. The third body plane is the transverse plane. The horizontal plane divides the body into upper and lower sections, as shown. The transverse plane allows us to describe the body in terms of up and down. The upper part of the body is the superior section, and the lower part is the inferior section. Moving from the midline toward the head is moving in a superior direction, or superiorly. This is also the cephalad direction. Moving from the midline toward the tailbone is moving in an inferior direction, or inferiorly. This is also called the caudad direction. In addition to the terms you've learned so far, several other words are commonly used to refer to body directions and locations. For example, moving from the trunk of the body toward the end of the limb, such as an arm or leg, is moving in a distal direction, or distally. Conversely, moving from the end of an arm or leg toward the trunk of the body is moving in a proximal direction, or proximally. Distal and proximal are opposite directions. Body directions and locations can also be described in terms of depth. Structures on the surface of the body are said to be superficial or external. Structures below the surface and inside the body are said to be deep or internal. So external and internal are opposite directions. Another system for describing the body is based on cavities and their internal organs. Rather than planes and directions, a cavity is a hollow space. It is surrounded by bones or muscle that support and protect the organs and structures within the cavity. There are 5 main cavities in the body. The cranial cavity is the hollow space that is within and is protected by the bony cranium of the head. The cranial cavity contains the brain, cranial nerves, and related structure. The spinal cavity runs down the back. It is a continuation of the cranial cavity as it travels down the midline of the back. The cavity lies within and is protected by the bones of the spine. It contains the spinal cord, spinal nerves, and related structures. The thoracic cavity lies within the chest and is surrounded by the breastbone anteriorly, the ribs bilaterally, bones of the spine posteriorly, and the diaphragm inferiorly. It contains the heart, lungs, and other structures. The abdominal cavity lies within the abdomen and is surrounded by the diaphragm superiorly, the abdominal wall anteriorly, and the bones of the spine posteriorly. This cavity contains the stomach, small intestine, large intestine, spleen, liver, gallbladder, pancreas, and kidneys. Finally, the pelvic cavity is a continuation of the abdominal cavity. It is surrounded by the hip bones bilaterally and anteriorly, and the bones of the spine posteriorly. The pelvic cavity contains the large intestine, uterus, bladder, some of the male genitalia, and other structures. Together, the combined space of the abdominal and pelvic cavities is called the abdominopelvic cavity. This illustration shows the location of the 5 main body cavities. Notice that the cranial and spinal cavities are continuous with each other. The thoracic cavity is separated from the abdominal cavity by the diaphragm. Also, the abdominal cavity is continuous with the pelvis. Let's start with quadrants. As shown, the 4 quadrants of the abdominopelvic surface are the right quadrant, or RUQ, the left upper quadrant, or LUQ, the right lower quadrant, or RLQ, and the left lower quadrant, or LLQ. These quadrants are formed when a horizontal line and vertical line cross at the umbilicus. The liver can be felt in the upper right quadrant and the stomach in the left upper quadrant. A patient with appendicitis has pain in the right lower quadrant. Moving on, the 9 regions of the abdominopelvic area are the right and left hypochondriac regions, the epigastric region, the right and left lumbar regions, the umbilical region, the right and left inguinal regions, and the hypogastric region. As shown, these 9 regions are formed when 2 horizontal lines and 2 vertical lines form a square around the umbilicus. Still, another way to study the human body has nothing to do with directions or regions, but rather with specific body parts and how they work. This is the anatomy and physiology approach. Anatomy is the study of the structures of the human body. Physiology is the study of the function of those structures. Anatomy begins with the cell, the smallest independently functioning structure in the body that can reproduce itself. Cells combine to form tissues, and tissues combine to form body organs. Several organs and related structures combine to form a body system. Studying body systems is a standard approach used in anatomy and physiology textbooks and many medical terminology textbooks. However, in medicine, body systems are always studied within the context of medical specialties. Medical specialties, not body systems, are used to name departments in the hospital, such as the Department of Cardiology. They're also used to name medical specialists, for example, cardiologists. Because this class and the textbook that we're using is about medical language, its chapters are based on medical specialties, just in the world of medicine. Let's go through the medical specialties one by one. Dermatology is what? It's the medical specialty that deals with the integumentary body system, which is another word for the skin. The system consists of the skin, your hair, your nails, subcutaneous tissue, and related structures. A dermatologist is a physician, a doctor who specializes in dermatology. Gastroenterology is the medical specialty that deals with the gastrointestinal system. This system consists of the mouth, the throat, esophagus, stomach, intestines, and related structures. A gastroenterologist is a physician who specializes in gastroenterology. Pulmonology is the medical specialty that deals with respiratory system. This system consists of the nose, throat, larynx, trachea, bronchi, lungs, and related structures. A pulmonologist is a physician who specializes in pulmonology. Cardiology is the medical specialty that deals with the cardiovascular system. The system consists of the heart, arteries, veins, capillaries, and related structures. A cardiologist is a physician who specializes in cardiology. Hematology is the medical specialty that deals with the blood, while immunology is the medical specialty that deals with the immune system. These two specialties are often grouped together because both involve the blood cells, plasma, lymph glands, lymphoid tissues, and organs and related structures. A hematologist is a physician who specializes in hematology, and an immunologist is a physician who specializes in immunology. Continuing to look at our medical specialties, we have also orthopedics. That's the medical specialty that deals with skeletal and muscular systems. The skeletal system consists of bones, cartilage, ligaments, joints, and related structures, while the muscular system consists of muscles, tendons, and related structures. Both body systems fall within the same specialty because of their components and functions are so closely related. An orthopedist is a physician who specializes in orthopedics. Neurology is a medical specialty that deals with the nervous system. The nervous system consists of the brain, cranial nerves, spinal cord, spinal nerves, other nerves, and related structures. A neurologist is a physician who specializes in neurology. Urology is the medical specialty that deals with the urinary system. This system consists of the kidneys, ureters, bladder, urethra, and related structures. A urologist is a physician who specializes in urology. Hearing a common thread there? Male reproductive medicine is a medical specialty that deals with the male genitourinary system. The system consists of the scrotum, testes, prostate gland, penile urethra, penis, and related structures. A male reproductive specialist is a physician who specializes in male reproductive medicine. Some urologists also treat male patients with reproductive issues. Gynecology is the medical specialty that deals with the female reproductive system, while obstetrics is the medical specialty that focuses on treating women during pregnancy and childbirth. Both specialties involve the breast, ovaries, uterus, vagina, and related structures. A gynecologist is a physician who specializes in gynecology, and an obstetrician is a physician who specializes in obstetrics. Often, an individual physician may be trained in both. Moving on, endocrinology is the medical specialty that deals with the endocrine system. This system consists of the hypothalamus, pituitary gland, pineal gland, thyroid gland, parathyroid glands, thymus, pancreas, adrenal glands, ovaries, and testes. An endocrinologist is a physician who specializes in what? Endocrinology, right? Ophthalmology is the medical specialty that deals with the eyes, lacrimal glands, and related structures. An ophthalmologist is a physician who specializes in ophthalmology. Finally, otolaryngology is the medical specialty that deals with the ears, nose, sinuses, throat, and larynx, or your ears, nose, and throat doctor is called an otolaryngologist. It's a physician who specializes in otolaryngology. Behind the system focused specialists we just discussed, there are other medical specialists that focus on particular parts of the body, specific diseases or treatments in selected populations. For example, dentistry is the medical specialty that deals with teeth, and a dentist who is a practitioner who specializes in dentistry. Dietetics is a medical specialty that deals with diet and nutrition. A dietitian or nutritionist is the practitioner. Geriatrics is a medical specialty that focuses on older persons. And a physician who specializes in geriatrics is known as a geriatrician or gerontologist. Neonatology is the medical specialty that focuses on newborn babies with medical problems. And a physician who specializes in neonatology is called a neonatologist. An oncologist is a physician who specializes in oncology, which is a medical specialty that focuses on cancer. Moving on, pediatrics is the medical specialty that focuses on children, and the name of specialist is a pediatrician. Pharmacology is the specialty that focuses on drugs, and the name of the specialist is a pharmacist. Psychiatry focuses on the mind and emotions. The name of the specialist is psychiatrist. Last but not least, radiology is the medical specialty that focuses on x-rays, sound waves, and other forms of radiation, and the name of the specialist is a radiologist. Now let's turn our attention from the body and health and look at the body and disease. Disease is any change in the normal structure or function of the body. This change may be slight and short-lived or severe and life-threatening. In comparison, a disorder is a disturbance of action or function. The word disorder is often applied to mental functions, and psychiatric conditions. The cause or origin of a disease or disorder is its etiology. In most cases, the etiology of a disease is known or can be discovered through a physical examination, laboratory, and diagnostic procedures. In some cases, however, the exact cause of a disease is never completely understood. Preventive medicine is healthcare that focuses on keeping a person healthy and preventing disease. Still, despite the best efforts of modern medicine, the human body does not always remain in a state of health, and diseases can occur. Diseases can be divided into different categories based on their etiology or cause. Let's look at each of these categories individually. A congenital disease is caused by an abnormality in the fetus as it develops, or by an abnormal process that occurs during gestation or birth. Laboratory and radiology tests allow some of these conditions to be diagnosed before the fetus is born. Cleft lip and cerebral palsy are both examples of congenital diseases. A degenerative disease is caused by the progressive destruction of cells due to disease or the aging process. Some examples include multiple sclerosis, hearing loss, and arthritis. An environmental disease is caused by exposure to substances in the environment. Examples include breathing problems from smoking, allergies to pollen, and skin cancer from sun exposure. A genetic disease is caused by mutation in a person's genes or chromosomes during fetal development. Down syndrome is a well-known example of a genetic disease. A hereditary disease is caused by an inherited recessive defective gene passed to a child from a parent who carries the defective gene but does not necessarily have the disease. Some examples are cystic fibrosis, hemophilia, and sickle cell disease. A hospital-acquired infection is caused by exposure to a disease-causing agent while in the hospital environment. These conditions were previously known as nosocomial infections. An example of a hospital-acquired infection would be a wound infection that develops after surgery. An iatrogenic disease or condition is caused by medicine or treatment that was given to the patient. Examples include giving the wrong drug to a patient, performing surgery on the wrong body part, which is important to know what is right and left in your quadrants, right, in your planes, and the side effects of prescribed medications. An idiopathic disease has no identifiable cause. One example is idiopathic thrombocytopenia, which is a disease of the blood, but they don't know why. What causes that? Then you have infectious disease. That's caused by a pathogen such as bacteria, virus, or fungus. COVID is an example of an infectious disease caused by a virus. HIV is another example. Some infectious diseases are also classified as communicable, like COVID. A communicable disease is an infectious disease that is transmitted by direct or indirect contact with an infected person, an infected animal, or an insect. Examples of communicable diseases include gonorrhea, rabies, and tuberculosis. A neoplastic disease is caused by the growth of either a benign non-cancerous mass or malignant cancerous mass. Examples include benign cysts and cancerous tumors of the skin. Finally, a nutritional disease is caused by a lack of nutritious food, insufficient food, or inability to utilize nutrients. Examples of nutritional diseases include malnutrition and pernicious anemia. No matter what type of diseases they have, people often notice the disease's beginning or onset because of the appearance of symptoms or signs. A symptom is any deviation from health that is experienced or felt by the patient. When a symptom can be seen or detected by others, it is known as a sign. An elevated temperature, coughing, tremors, paleness, vomiting, or a lump that can be seen or felt would all be signs of disease. Both symptoms and signs may be acute, subacute, or chronic. Acute signs and symptoms are sudden in nature and severe in intensity. Subacute signs and symptoms are less severe in intensity. Chronic signs and symptoms are those that continue for 3 months or more. An exacerbation is a sudden worsening in the severity of a disease's symptoms or signs. Conversely, a remission is a temporary improvement in the symptoms or signs of a disease, even though the underlying disease has not been cured. A relapse or recurrence is a return of the original symptoms or signs of disease. A sequela is a complication that is caused by the original disease and remains after the original disease has resolved. Symptomology is the clinical picture of all of a patient's symptoms and signs. Patients who are asymptomatic, meaning they show no signs or symptoms, can still have a disease, although that disease can only be detected by laboratory or diagnostic procedures. A syndrome is a set of symptoms and signs associated with and characteristic of a particular disease. The course of a disease includes all events from the onset of the disease until the final outcome. The course and outcome of a disease can be affected by treatment when the physician prescribes drugs or orders therapy for the patient. If the treatment is therapeutic, the signs or symptoms of the disease disappear. A refractory disease is one that does not respond to treatment. Certain diseases that cannot be treated with drugs or therapy may require surgery. The prognosis is the predicted outcome of a disease. The natures of many diseases are so well known that physicians can predict with a great deal of accuracy what a patient's course and outcome will be, which could be like with cancer or terminal illnesses. Generally speaking, the course of a disease ends with one of the following outcomes. With recuperation, the patient experiences a recovery and returns to a normal state of health. With residual chronic disease or disability, recuperation is not complete. With terminal illness, the patient cannot recover and the disease eventually leads to death. Now that you're familiar with various concepts of health and illness, let's take a look at how healthcare is delivered in today's world. Modern healthcare involves many types of professionals working together as a team. Usually, a physician or doctor leads the members of the healthcare team and directs their activities. The physician examines the patient, orders tests, diagnoses diseases, and treats diseases by prescribing drugs or therapy. Physicians who graduate from medical school receive a Doctor of Medicine or an MD degree. Physicians who graduate from a school of osteopathy receive a Doctor of Osteopathy or a DO degree. After medical school, Physicians complete residency training and select a specialized area for their medical practice, such as psychiatry, which is, remember, mental health, and pediatrics, which is dealing with children. Surgeons are physicians who complete additional training in surgical techniques. Primary care physicians, or PCPs, are physicians who specialize in family practice or pediatrics. They see the majority of patients on a day-to-day basis in their office. Unlike PCPs, other physicians work almost exclusively in hospitals. For example, a doctor who is on the medical staff of a hospital and admits patients to the hospital, directs their care, and discharges them is known as an attending physician. Beyond physician and physician extenders, other members of the healthcare team are generally classified as allied health professionals. Allied health professionals support physicians and perform specific services ordered by physicians. Nurses are perhaps the best known type of allied health professionals. Nurses, such as registered nurses, licensed practical nurses, or licensed vocational nurses, examine patients, make nursing diagnoses, and administer treatments or medicines ordered by physicians. Nurses give hands-on care and focus on the physical and emotional needs of the family. Other allied health professionals include technologists, technicians, therapists, as well as dietitians, medical assistants, phlebotomists, dental hygienists, and audiologists. Just as healthcare involves many types of professionals, it also occurs in many types of settings. A hospital is the traditional setting for providing care for patients who are acutely ill and require medical or surgical care for longer than 24 hours. Each hospital stay begins with an admission and ends with a discharge from the hospital. The attending physician must write an order in the patient's medical record to admit or discharge the patient. The attending physician also monitors the patient care and orders diagnostic tests, treatments, therapies, medicines, and surgeries as needed. A patient in the hospital is called an inpatient. Hospitals are divided into floors or nursing units that provide care for specific types of patients. There are also specialty care units such as ICU, intensive care unit, ancillary departments in the hospital provide additional types of services. They include the radiology department, physical therapy department, dietary department, emergency department, clinical laboratory, and pharmacy. Finally, the non-medical departments of a hospital provide other services such as health information management, billing, housekeeping, and so on. Another site where healthcare is provided is the physician's or doctor's office. In fact, the physician's office is one of the most frequently used healthcare settings. Typically, a single physician or group of physicians maintains an office where patients are seen, diagnosed, treated, and counseled. Some offices have their own laboratory and x-ray equipment for performing diagnostic tests. Seriously ill patients who cannot be quickly diagnosed or adequately treated in the office are sent into the hospital. A clinic provides healthcare services similar to those of a physician's office, but for just one type of patient or one type of disease. For example, a well baby clinic provides care to newborn infants, and a methadone clinic treats recovering drug addicts. Outpatient clinics are located in a hospital or in a separate facility. Their patients are known as outpatients because they are not admitted to the clinic and do not stay overnight. Walk-in clinics, often located in or near pharmacies, provide services such as treating injuries or illnesses, giving immunizations, and performing sports physicals. They are typically staffed by a nurse practitioner. Urgent care clinics are similar to walk-in clinics, but they have additional capabilities and a physician on staff. These clinics can treat patients with more serious illness and injuries, but not life-threatening ones. Urgent care clinics are often during times when primary care offices are closed. Other types of healthcare settings include ambulatory surgery centers, long-term care facilities, home health agencies, and hospices. An ambulatory surgery center is a facility where minor surgery is performed and the patient does not stay overnight. A long-term care facility, previously known as a nursing home, is primarily a residential facility for older adults or individuals with disabilities who are unable to care for themselves. Long-term care facilities provide 24-hour nursing care. A home health agency provides a range of healthcare services to persons in their homes. These services are particularly useful for individuals who are unable to come to a physician's office or clinic and do not want to live in a long-term care facility. Lastly, a hospice is an inpatient facility for patients who are dying from a terminal illness and have less than 6 months to live. Hospice services are aimed at keeping patients as comfortable as possible, as well as providing emotional support for patients and their families. Hospice care can also be provided in a patient's home. Regardless of setting, before a physician can diagnose a disease or make a prognosis about its outcome, he or she must take the patient's medical history and perform a physical examination. The physician begins by asking about the history of the present illness. This includes questions about the location, onset, duration, and severity of the patient's symptoms. Next, he or she asks about the patient's past medical history, past surgical history, family history, social history, and history of drug allergies. All of these details help point to a particular disease or eliminate a particular disease as the cause of the patient's problems. After taking the patient's history, the physician performs a physical exam to look for signs. During the physical exam, the physician uses a variety of techniques as needed, including inspection, palpation, which is touch, auscultation, which is listening, and percussion. Inspection involves using the eyes or an instrument to examine the external surfaces or internal cavities of the body. Palpation is using the fingers to feel the masses or enlarged organs or detect tenderness or pain. Auscultation is the use of a stethoscope to listen to the sounds of the heart, lungs, or intestines. Percussion is using the finger of one hand to tap on the finger of the other hand that is spread over body cavity, then listening to the sound that is produced. Ideally, based on the patient's history and the results of the physical exam, the physician can rule out most diseases and make a diagnosis that identifies the nature and cause of the disease. If it isn't possible to make a diagnosis, the physician makes a tentative or working diagnosis, then orders labs and diagnostic procedures or refers the patient to a specialist for a more detailed evaluation. Many of the medical language skills discussed in the first part of this chapter are used when dealing with medical records. Let's briefly look at some of the more common types of medical records. In general terms, the medical record is where healthcare professionals document all care provided to a patient. In the past, the medical record was mainly used to document diseases, treatments, and surgeries. Now the medical record emphasizes keeping the patient in good health and preventing disease before it begins. In decades past, medical records were kept on paper. Paper medical records, however, have a number of disadvantages. For instance, they can only be accessed by one person at a time, they can be lost or damaged, and they can take a long time to retrieve if stored off-site. This delay can compromise the delivery of quality care. To address these shortcomings, in the modern world now, we have technology. Most physician offices, hospitals, and other healthcare facilities have converted to electronic health records, or EHRs. The format and content of an electronic health record varies from one setting to the next. Physicians' offices and clinics often use checklists and short narrative notes. These notes usually contain a brief history of the present illness, pertinent past medical or surgical history, the physical examination, the diagnosis, any treatments, and then a follow-up plan. Hospitals have more extensive documentation in their electronic health records. Common documents for a hospitalized patient include the admission history and physical form, the H&P, the operative report, and the discharge summary, or DS. These documents include standard headings such as chief complaint, history of present illness, past medical history, social history and family history, review of system, physical examination, laboratory and x-ray data, diagnosis, and disposition. In addition, physicians write orders and progress notes, nurses write nurses' notes, and other departments contribute notes or use pre-printed forms to record information. A medical record must also contain certain legal documents such as a consent to treatment form and a HIPAA release form. This form is required by federal regulations stemming from the Health Insurance Portability and Accountability Act of 1996. Allows a healthcare facility to contact the patient's insurance company to obtain payment for any care that is provided. Here are the abbreviations you learned in this chapter. Take a few minutes to review them. You have the ED, the LLQ, physical therapy, PT, RN, registered nurse, social history, SH, skilled nursing facility, SNF. And that's the end.